You are all welcome to this session. My name is Kilian Robina, and I will still continue taking you through this session of normal midwifery. Today, we are basically looking at physiological changes that occur during pregnancy. So, by the end of this session, we expect that the learners should be able to identify anatomical and physiologic changes during pregnancy for nursing care, then assess subjective, objective, and diagnostic changes in pregnant patients, contrast types of pregnancy tests, examine emotional and psychological changes in women, partners, and families during pregnancy. So, right there, we have an image of the pregnant woman. So basically, when we talk about normal pregnancy, we refer to a physiological process that involves the development of the fetus inside the uterus of the woman. But there are certain characteristics that really stipulate that this is a normal pregnancy. And these characteristics are as follows. A normal pregnancy should last about 40 weeks, divided into three trimesters, as we looked at it in the previous recording, where I talked about the first trimester, the second trimester, and the third trimester. So previously we had looked at the changes that happens to the baby in all the three trimesters. That development that takes place from the zygote, the embryo, until the fetus, until it's ready to be delivered at 40 weeks, at the 37 to 40 weeks. So right here, uh, we are also saying that the pregnancy should last 40 weeks, and these 40 weeks are divided into three trimesters. Another characteristic also, it requires regular prenatal care. So it requires that the mother has to be cared for regularly, as stipulated by the antenatal care um, visits or schedules that are mentioned by WHO. So it also involves common symptoms such as nausea, fatigue, breast tenderness, mood swings, food cravings, and the weight gain. So these are some of the minor signs that can be involved during pregnancy. So it may also cause some discomforts or minor problems, so though they should not be very complicated. A normal pregnancy results in a normal labor and the normal delivery, and it requires postnatal care. So the normal pregnancy should last up to 40 weeks with a variation of plus or minus 2 weeks. So the fetus can be delivered 2 weeks before or can be delivered 2 weeks after. It is still considered to be normal. So it's commonly divided into three main categories. We have preterm, which is between 20 to 36 weeks. Then term, that is 37 weeks or 38 weeks of gestation. Then post-term, which is 41 to 42 weeks. So these categories help in assessing the pregnancy's progression and the associated risks.
Yes, yes, sir. Okay. Information I have with you. See, hadi akajitamika like 8 minutes somewhere yakavaa awendita nakomea
So there was some problem with the network, but let us continue. I think we are now.
bad prayer. Some will send them somewhere in town. Good I send. Hello.
Yes.
And Madam, could
The
you?
next person went.
Mm,
I needed to confirm from you.
okay. Think we can continue.
I continue from where I stopped or it.
We can continue. I think we shall edit out what is not necessary, but you can continue maybe from that slide which you were presenting. Mm.
Okay, so we are talking about presumptive signs, and under the presumptive signs, these are the signs that presumable. We are not sure whether the mother is pregnant, but the signs are suggestive of pregnancy. The signs are suggestive of pregnancy, though these signs can still be positive because of other conditions. So these signs appear with the symptoms of menstruation, nausea and vomiting, fatigue, urinary frequency, the quickening. So nausea and vomiting, fatigue is like when the woman feels tired, like she has done something very heavy. The urinary frequency, the woman goes to urinate every now and then compared to how usually she passes urine. Then quickening, this refers to the fast speed movement that is felt by the mother. So sometimes there can be contractions of the muscles in the abdomen that it can be assumed to be quickening. So that is why this is also lying under presumptive signs. Then the probable signs, we have signs like these are changes that can be got on examination when the mother is examined, and they are more reliable indicators. For instance, abdominal enlargement usually noticeable around the 14th month. Then biological men, that the mother is being checked when it is pushed to the other side and it touches the other side of the hand. It can let me go back to where I resumed from.
Okay.
So talking about presumptive signs, these are the signs that presents in a woman, and the woman can be presumed to be pregnant. So they are called presumptive signs because any other condition can be able to cause death to the woman. This include amenorrhea. Amenorrhea is absence of menstruation. Then nausea and fatigue, a situation where the woman feels tired, like she has done very heavy work. Then urinary frequency, the number of times or how often the woman goes to pass urine increases. Then quickening refers to the fast speed movement that can be felt by the mother. So this is also taken as a presumptive sign because sometimes muscles of the abdomen can contract and it can be presumed to be quickening. Then probable signs, these are changes that are observed by the examiner. So they are more reliable indicators. Examples include abdominal enlargement, ballotment. Ballotment is a technique used during a vaginal examination to feel for the rebound effect when the baby moves against the cervix. So the midwife inserts the female first into the vagina, then tries to push the cervix. Also, she balance the cervix. If it bounces back, if it rebounds, then it could be that the woman was pregnant. Then it can also be done externally when the midwife plots the mass between her two cups, pushing it to the other side with her hand, then also trying to push it to the other side. So if it moves inside like a ball, then that is a sign that the mother may be pregnant. Then another sign is cervical softening, the cervix will become softer and possibly bluish if it is observed, and this is because of the increased supply of blood into the cervical area. Then probable signs still continue. We have the Braxton Hicks contractions. These are a kind of contractions that come that the man feels when she is pregnant. She is tending to go into labor, but she is not in labor. So sometimes they are coming the uterus practices going to labor. Then we have pregnancy tests. So, while generally reliable, they can sometimes produce false results. So that's why they are termed under the probable sign. So most of these pregnancy tests are those ones that are over the counter exhibits. Then we have the positive signs. These are the signs that confirm that the woman is really pregnant. And these are the only reliable signs that we can rely on to pronounce pregnancy. So examples include auscultation of fetal rate and heart sound. When you listen to the fetal heartbeat and you feel it beating, that is a positive sign that is the woman is pregnant. Then visualization of the embryo of the fetus through ultrasound. When the mother goes for ultrasound and is checked and the images of the fetus are seen, then that is a positive sign. Then we have Nagel's rule. Talking about Nagel's rule, this is a rule that is a standard method for calculating the estimated date of delivery. So when we are calculating this estimated date of birth, according to Nagel's rule, it is the last normal menstrual period minus 3 months plus 7 days plus 1 year. So it assumes an average pregnancy duration of 40 weeks from the first day of the last menstrual period. So we are looking for the last day of the normal menstrual period. If the mother always goes for her period for 6 days, we ask her on the last menstrual period that you had, when was the first day? When did it first? So if it is started on the 8th, then the mother will conclude that it is started on the 8th that you take. You don't take the last day, you take the first day. So a gestation is a helpful we can help ED. This will helps us so much to save time as far as calculation of the EDP is concerned. So let us look at the gestation wheel. A gestation wheel is a circular tool often made of plastic or cardboard with the two scales. So it has the outer scales which shows the weeks of pregnancy, typically from week 1 to 14. Then we have the inner scale which displays information about the baby's development at each stage. For instance, estimated fetal length and weight, major milestones in organ development, paternal symptoms and symptoms, upcoming medical appointments. So all this one is included in the inner scale, and it is very, very helpful. If you see it is helpful for the mother. When the mother is experiencing certain changes in her body, like for instance, nausea, you check if she is, for instance, in the 8th week and she experiences nausea or vomiting, we don't say that she is weak. Why? Because this is expected during that time of pregnancy. Then how to use the gestation wheel. Determine the current week of pregnancy. This can be based on last normal menstrual period or through an ultrasound. Then align the current week on the outer scale of the wheel. Then after that, read the information about the fetus development and your expected date changes on the inner scale. So, benefits of using the gestational wheel. Benefits of using gestational wheel provides a visual representation of pregnancy progress. You can see how where your progress, your pregnancy is progressing. Then can answer questions about common pregnancy symptoms and changes. Offers a tool for planning and tracking prenatal appointments. Then limitations of gestation wheels include the following. Gestation wheels are estimates and individual development may vary. So these are standards, but sometimes of individuals they can vary. If the variation is not so huge, then we still take it to be normal. But if it is very huge, then that is when worry can arise. Then they are not a substitute for professional medical advice. So mothers will have the gestational wheel. If the mother is having the gestational wheel, she still needs to always visit her midwife, always visit her doctor so that she can get medical advice. Then information on some wheels may not be up to date or entirely accurate. So you need to watch out for those wheels that have outdated information. Physiological responses during pregnancy. In the first trimester, the mother is likely to have nausea, fatigue, tingling of breasts. Tingling is like specifically like some tiny things piercing the mother in the breast. That is how I can explain it. Then increased urinary frequency, basically due to pressure on the bladder. Then increased vaginal discharge. Positive signs like Chadwick's sign, which is the blue tint of the vagina, and the Godel's sign, which is softening of the cervix. Then dizziness, tender breasts, mood swings, increased sensitivity to smell. All this can happen during the first trimester. That is why you find in most cases the mother can smell even the smallest thing that is or the smallest sight that you can be able to smell. In the second trimester, fetal movements felt fetal heartbeat can be had with it. Then in uterus, right out of the pelvis, increase in urinary frequency, increase in blood volume, may lead to physiologic anemia. Blood becomes more diluted. So sometimes you say the mother is having less blood, and in most cases it is due to the fact that your tooth don't in the volume. So the then increase this skin pigmentation. For example, darkening of the areola and the appearance of the linear and urethra. So right there we have this image that is showing that in dark light. This is what is called the linear urethra. This one. Then the areola of the breast. This is the darkening of that dark part of the breast that is surrounding it. Then we have the stria gravidarum or stretch marks also here. Then we also have relaxation of smooth muscles, which increase the risk of varicose veins and in most cases, and also increase UTI. UTI stands for urinary tract infections. Then another one is Braxton Hicks contractions may also be affected. The mother feels like there are some contractions. There is some hardening that happens on the uterus. So it can be palpated by abdomen. Nausea and vomiting usually subside by this point. So by the second trimester, nausea and vomiting reduce a little and the mother feels better, and at this time this is when she can also have appetite and she can be able to eat something. Then third trimester, a period of greatest weight gain. This is where the mother gains a lot of weight. In most cases there is heartburn, which is due to the pressure of the stomach. The uterus has expanded because of the weight gain of the baby. The weight gain of the mother is also there, but the weight gain of the baby now leads to expansion of the uterus, which presses on the stomach, and because of that, the sphincter of the stomach opens, and the acidic content of the stomach moves into the esophagus, and because of that, it gives the mother heart attack. During this time, also there's decreased stomach capacity, which may lead to smaller, more frequent meals. So during this period, we advise the mother not to sit and eat fully at once, but she can eat in a small bits. When she eats, then she relaxes and she eats again, she relaxes like that. Then constipation can also occur, and this is because of compression of the bowel, since the since there is expansion, as a result, it can lead to constipation. Then shortness of breath, which may occur as the baby pushes on the diaphragm, limiting lung expansion. So the man may not be able to breathe properly. Decreased hemoglobin levels as the baby uses red blood cells from the mother. So because of that, there is decreased level of hemoglobin in the body of the mother. Then there's also increased varicosities due to pressure on the veins. That is why up there we have looked at varicose veins. Pedal or angioedema may be present, which usually resolves after the baby is born. There is also lightening occurring at this time, and this is because the fetal head is now entering into the pelvis, and as a result, creating a form of relief in the mother's upper abdomen, so she can be able to breathe. This is what is called the lightening. But again, on the other side, because of the entry of the head into the pelvis, there will be compression of the urethra, and as a result, it leads to increased urinary frequency. Then Braxton Hicks contractions are more noticeable at this time. There's also a waddling gait. which develops due to increased mobility of the pelvic joint. So you find that the mother's shoulders are pushed backwards, and the middle of the back is pushed forward to make sure that the balances. And then there's also swelling in the hands and face and the feet during pregnancy. But this, if it is severe, for instance, if the swelling is involving the hands, the face, and the feet at the same time, then this is signaling preeclampsia. So this is also the trimester in which preeclampsia is involved. So in the last month, the cervix opens and the cervix softens and begins to efface. So the cervix starts to be taken up. It starts thinning. That is what we mean by effacement. The mucus plug is dislodged and lost, which can result in a reddish brownish discharge. And this discharge is the one that we will refer to as show. So sleeping in a comfortable position is challenging, and it's advised not to sleep on the back as it may lead to compression of the descending aorta, which affects the inferior vena cava and hence leading to the decreased uh, flow to the placenta, and this can cause a problem to the fetus. Sometimes also this can make the mother to go this psychosocial responses during pregnancy. So during the first trimester, there is this kind of uncertainty. Am I really pregnant? So there, the mother is not certain about certain things. Is really not certain about the pregnancy. Is not sure whether she's happy to have the pregnancy and uh, many other things that happen. Then ambivalence. There are mixed feelings about the pregnancy. Should I take this pregnancy? Do I really need this baby? So sometimes that is why the pre-conception care is very important. If the pregnancy is planned for, then some of these kind of signs may not be felt by the mother. So serve as the primary focus. So the mother may not yet feel a strong connection with the baby during this early uh, stage of pregnancy. So she may instead focus so much about her life, how she's going to be affected with the pregnancy and many other things that she may not focus so much about how the baby will be. Then in the second trimester, there is physical evidence of pregnancy. Uh, this can be observed now, and when it is observed, then it creates that feeling of yes, really, I am pregnant. Then fetus will be a primary focus, so it will be more of the fetus should stay safe. Anything you do is attached to the fetus. It's like you have to make sure the fetus is in a safe situation. You have to feed well so that the fetus is okay. You don't have to stress yourself because the fetus is okay and many other things. So the fetus becomes the point of focus. Then narcissism and the introversion increase the awareness and focus on pregnancy, protection of the baby, and a shift in body image. You see, the mother starts adjusting her clothes, start adjusting the way she behaves, all those because she's aiming at making sure that the baby is safe. Then changes in the sexuality, emotional and physical changes can affect a woman's sexuality. So it varies. To some women, they they get detached from that sexual feeling. They feel like they should not go intimate with their partner. But to others, it draws them closer to their partners, and they feel like the partners always be intimate with them. So it varies from one person to another. So in the third trimester, there's this kind of vulnerability. As the due date approaches, some women may feel more vulnerable. They feel like they are helpless because they really are not sure of what is going to happen during delivery. Then increasing dependence. Many pregnant women seek the company of others for security during this period. They have to make sure at least there is someone around. And even if it is not their will, at least even people around them will also advise them to make sure that they get some people to give them support. If the partner was far away, this is the time that the partner is advised to be nearby so that it can give support. Then preparation for birth. Final preparations for birth are done at the deceased stage and everything is auto set. So steps in maternal role taking. One is mimicry, imitating the behavior of the other person, studying how
Again.
also, for instance, the first one of the right that we have to focus on other people. Though some of the kids will not do, then role play, actively engaging in the motherly role, making sure that you put yourself there to do what mothers are supposed to do, so that you also get affected with the situation. Then fantasy, creating scenarios and the image. If it is easier, creating scenarios, thinking about how the kids are going to be. Thinking about all the things that are about to happen.
Recording.
Then looking for emotions, trying that's steps. Then grief for coping with the loss of the body you had before pregnancy, their previous lifestyle, and sometimes their job as they adapt to the new role of mother. So this is something that the mother really has to adjust to her life to. For instance, there were clothes that she used to love, that used to fit her well, but at this point she cannot even touch them. So she needs to adjust her mind and slowly and slowly. Developmental tasks, accepting the pregnancy, identifying with the mother role, reordering personal relationships. Also, at this time, some of the partners retire themselves or distance themselves from their women. Why? Because they feel like they cannot become part of the kind of life that they have reached or they